Members call on Government Order of the Day number 16.
Debate on the report of the Health Committee on the inquiry into improving child health outcomes and preventing child abuse, with a focus from preconception until 3 years of age, volumes 1 and 2.
Dr. Paul Hutchison.
I move that the House take note of the report of the Health Select Committee on the inquiry into improving child health outcomes and preventing child abuse, with a focus from preconception until 3 years of age. Mr. Speaker, thank you and also the Business Committee for agreeing to this historical debate on our report. The timing of the debate, just before Christmas, that celebrates the birth of arguably the world's greatest child advocate, reformer and philosopher, is more than fitting, almost immaculate. May I acknowledge and thank all my colleagues from parties across the political spectrum who have worked hard to achieve a consensus over a range of extremely challenging issues, from reproductive health to optimal maternity care, from the socio-economic determinants of health and poverty, political leadership, to an all-of-government approach to improve nutrition and prevent the impending burden of long-term chronic diseases. I've really appreciated the thoughtfulness and contributions of Kevin Haig, Antoinette King and many others who, though we are miles apart on many political issues, see improving children's health, especially in the very early years, as a no-brainer. Some might say that our recommendations could have elements of nanny state, but I would argue that from a libertarian perspective, it behoves every parent, as well as the government, to do everything they possibly can to ensure all children have the chance to achieve their full potential, but as adults to be expected to exercise individual responsibility. May I sincerely thank all the submitters and expert witnesses who so willingly and passionately assisted us with this inquiry, as well as the Prime Minister, Minister of Health Tony Ryall, and my colleagues in the National Caucus who agreed to initiate the inquiry in the first place. We asked the government to put more focus and investment into the very early years, preconception to 3 years, because the evidence is overwhelming from science, from education, from health, justice and economics, that very early high-quality care and nurturing in child's lives gives the greatest chance of that child achieving their full potential, leading a long and productive life. This is an investment approach from the work of Nobel laureate economist James Heckman. The rate of return